thrilled to be back here with Dr. Kubicka of Clinicbe in this whole world of looking and feeling good. And I just wanted to ask you a little bit about when people perhaps shouldn't be having procedures. There's so much pressure nowadays, it seems, that I should be looking good and feeling good and having this done and that done and seeing other people looking wonderful on TV or on the pages of our magazines. But I wonder, are there times where people shouldn't be having procedures?
It's a very tricky place because there's a balance between the moment that the treatment will help, because if you feel just a little bit under the weather and not really great about yourself, it's a great time to do the treatment. But if it's just a little bit farther down that road and you feel really bad about yourself and you expect something to go wrong, maybe not consciously but subconsciously, it's probably the worst time to do anything.
So there's something about where you are at within yourself, about whether you're feeling, at that point where you're aware of and you recognise that might be apt to have that conversation and explore it. And other times when you're feeling so bad, you're just not going to be in the right place to have the treatment.
And as much as there is responsibility on the person who comes through the door, it's a responsibility on the therapist, on the doctor, because we can see it from outside and we can judge, and sometimes it's just about the day that it's not the greatest, and somebody's too nervous or too stressed, and it just doesn't go so well, or the results are not as good. In terms of making decision of starting the treatment or going first time, I would say definitely not. Decisions shouldn't be dictated by pressure from outside, whether it's a comment of somebody else or whether it's somebody else who is doing a procedure, recommending and pushing us to do something, or whether it's general message in the media. So there are things that it's interesting and it can take in consideration, but we shouldn't make a decision based on that.
I see. And are there times that you see that you feel actually the person doesn't need? So you've talked about the thing about actual timing, whether I feel in a good place or not. You've talked a little bit about those external pressures. And are there other occasions just where you just think, or you might find that it's not necessary or it's not going to be beneficial for them? Can you tell us a little bit about that? And I imagine that sometimes that too could be tricky sometimes.
Absolutely. It's there are situations when especially there is a big change in life, whether it's experiencing a loss, whether it's a broken relationship, whether it's a loss of job, whether it's any other significant stressful issue. I would say in the first stage of that, in the shock after the event, we shouldn't do any treatments, because we won't make the right decisions. It's a time just to wait. Then after, when we still experience that and we can still feel connected to the situation, but we are already better, we're coming out of it, that's a great time to do something, because we are already on the way up, and it's a way to move forwards by being excited about making a change, starting something new. Saying so, there will be a time, even during this process from very beginning, to come for consultation and have a chat and finding what it's there for us. But it shouldn't be the decision based on the impulse, shouldn't be decision based on under the pressure, or because somebody else had it done or somebody else looks good and we want the same. So whether it's jealousy, envy, things like this should always be taken in consideration.
That's so useful. And I just want to ask one final question linked about that. And you've given us so much information there. What's your personal take on how, in terms of stylistically, how you help people with that here again at Clinicbe? Because I know again that's something that you're passionate about, this whole patient relationship. So can you tell us a little bit about how you handle that dance here? Because we live in this era that we've touched on, where there's so much pressure. I should be looking like this. I should be feeling like this, either at this stage of life or generally.
I think that the most important is to stay who we are. And to do so, we need to be able to choose between the things that are suitable for us and are just there. Therefore, the choice of you shouldn't do things because somebody else has have it done and it looks good, because it has to be something that it's suitable for our face, for our condition, and that's the reason why the consultation is so important. Very often people do think that because the procedure is good, it will be good for them.
I see.
It's not always the case, and that has to be always discussed prior to the treatment.
So as with all those things, that the relationship, I'd imagine, with the clinic, with the specialist, is absolutely key, so that you can get
Trust,
that absolutely right.
And I believe that the bigger part of responsibility lies on the practitioners rather than on the person, because obviously we are confused with the amount of information and with contradictory information as well, that it's very easy to be overwhelmed with all of it, but it's up to the doctor, up to the nurse to explain it and discuss the options.
That is so useful. Thanks again for your time. Thank you.
Thank you.